Hello, my name is Leslie Montehioca and my teaching presentation is on CT. Patient history. Knowing a patient's history is important because if they're diabetic or if they're allergic to shellfish, then they might not be able to use iodine. Taking down a patient's history is one of the most important steps to make sure the patient is safe and that nothing happens to them while the exam is being taken. Patient prep for different studies. If the order is with or without contrast, the patient should not have anything to eat 2 to 4 hours prior to the exam. Only clear liquids. If the patient is diabetic taking glucophage or metformin, they will have to stop taking it before the exam. CT examinations without contrast does not need any prep. CT examinations with contrast. Drink first bottle of contrast 2 hours prior to the examination. Drink the second bottle of contrast 60 minutes prior to the examination. If the patient is taking the contrast orally, it's good to let them know that they might feel warm sensation through their body or they may feel like they urinated. They might also have a metallic taste in their mouth. Patient care info, IV info. To help keep the patient hydrated and minimize the kidney risk, they place fluids through the IV. Infiltration care. If the fluid does not irritate tissue, it's called infiltration. If the fluid does irritate tissue, then it's called extravasation. Infiltration care is when you elevate the site as much as possible to help reduce swelling. Apply a warm or cold compress depending on the fluid for 30 minutes every 2 to 3 hours prior to help reduce swelling and discomfort. Medication every 24 hours if the patient needs it. Extravasation care is a little more serious, so you have to stop the infusion. You have to remove as much drug as possible using a 10 to 20 milliliter syringe. Alleviate any pressure on the affected area. Alert a doctor so that they can start treatment. Elevate the limb. Administer pain relief if the patient needs it. Monitor the area for infection or further injury progression. The follow-up care and discharge instructions is continue to use cold or hot compresses, rest and elevate the arm to reduce swelling and pain, protect the area from sunlight, check with the doctor about what hygiene products could be used in the area. If you observe a fever or other signs of infection or swelling or damage gets worse and pain increases, let the doctor know. Also, making sure the patient knows to drink a lot of water to help pass the contrast along their body. Different types of contrast and purpose. Contrast is used to visualize organs, blood vessels, and tissue types to see if there are any types of disease or injury. The contrast helps highlight and locate the area better. The patient might have to take something orally, rectally, or intravenously. Iodine-based intravenous is injected directly into the vein, and this helps your blood vessels, urinary tract, liver, and gallbladder stand out. Barium sulfate or gastrografin is liquid that you take orally, enhances the image of your digestive tract and the pathway of food through your body. Why do a CT? CT is one of the fastest and most accurate modalities. It is best to detect bone and joint problems. They can help locate tumors, blood clots, excessive fluid, cancers, heart diseases or infections, internal injuries and bleeding, trauma caused in the brain. Doctors also use CT scans to create treatment plans and then compare it to how the patient was before the treatment. Importance of patient medication. All patient medication must be discussed with a doctor before the day of the exam. Patients should not take metformin or glucophage. Patients should arrive with medication list or knowledge of the medication that they're taking. It is important to know the medications because they might cause a reaction with the contrast. Pre-medication for contrast. Methylprednisolone, Medrol, and prednisone, and diphenhydramine are pills or medication that the patients can take before the contrast in case they've ever had an allergic reaction or they might need something else. There's also other different medications there to take in case. Contraindications to having a CT. Pregnancy, excessive radiation exposure, contrast contraindication, iodine sensitivity, selfish allergy, kidney disease, and there's a weight limit on machines. CT accessories, examination table, power injector, bed straps, head holder, foam wedges, knee rest wedge, and a lot more accessories. This is a chest CT with contrast and without contrast and some labeling. Then we have the abdomen CT with contrast, and the other one has contrast. Then we have a pelvis without contrast and with contrast, and a head CT. The top is without contrast and the bottom is with contrast. And this is just a picture of a person, and the person is just kind of cut into different images and slices of her brain, her neck, her chest, abdomen, pelvis, and I just thought it looked really nice to see the different types of slices and how they all looked with contrast and without contrast. Important lab values: bond 8 to 22, creatine 0.6 to 1.2, HCG less than 5, GFR greater than 90. CT physics: CT captures more in detail than X-ray. The current CT machines use a spiral CT, which is a single radiation source with multiple detectors that rotates around the patients, obtaining different views. And there's phases where it refers to when the image was taken, the contrast was administered, which is non or pre-contrast, arterial, venous, and delayed. And on top you can see the different slices. There's axial, there's coronal, and there's sagittal. CT artifacts: there's metal, there's high concentration of IV contrast, there's motion, which is the most common. CT artifacts are common and can look like pathologies in an image. There's also different type of artifacts, like patient-based artifacts, physics-based artifacts, and scanner-based artifacts. CT windowing, also known as a gray level mapping, contrast stretching, histogram modification, or contrast enhancement. Windowing is a process where the CT image grayscale components of an image are manipulated by the CT numbers. The image will change appearance by highlighting the structures. The brightness is adjusted by the window level. The contrast is adjusted by the window width. And these are the different windows. So we have the soft tissue window, which is negative 125 to positive 225. Used to view most organs except lung parenchyma because it's outside the window range. Then we have the lung window, which is negative 1200 to positive 800, which is used to view the lung parenchyma and would appear gray and the air would appear black. Then we have bone window, which is negative 700 to positive 1300, which is to view bone detail. The bone will come out white in the images and everything else will be gray or black. And the bottom there's a diagram of just the different windowing and the numbers. And these are the references I used for my PowerPoint.